As the name suggests, tension headaches are headaches due to adverse tension in the muscles around the head, the neck and the top of the shoulders. Commonly what's happening is there's knots in those muscles, trigger points that are causing localized pain. Could be muscles in the scalp themselves, or the pain could be coming from knots in the top of the shoulder that are causing referred pain. So sort of phantom pain, if you like, up into the head. Sometimes though, the pain is actually coming from or being caused from the joints in the neck. And that will either mean that the muscles around that joint are seizing up, or the pain itself is coming from those joints, and also that pain from those joints can also cause referred pain from the neck to the head as well. In terms of the reason for this build-up in tension in the first place, it could be various things. It could be poor posture, it could be sort of holding your shoulders tight when you're at the computer, it could be related to an injury, such as whiplash for example. Also stress does play a part, so if you're very stressed and it's naturally very tense, that's going to cause a build-up in tension. The problem though is that once these knots and trigger points start to form in the muscles, they can be very stubborn, and even if the original reason for them happening in the first place has long since gone, you've recovered from the whiplash injury, the stress has gone in your life, once those knots are formed, they have a kind of muscle memory, and they often will be there in the background, and they're kind of need treating, need getting rid of. They're still there to stay and won't go on their own necessarily. I think the first and most important thing is to identify precisely where the pain is coming from. So we need to see or show a patient exactly where that pain is coming from. So it means reproducing that pain pattern whilst they're with us in clinic. So we'll go through a process of deep sort of palpation, feeling the muscles, feeling the neck joints, feeling the areas around the head to see if we can replicate their headache. Now the thing is, let's say for example a patient's coming in and they've got pain in the side of their head. There's actually several different muscles around the neck and shoulder area that can reduce referred pain into that area. So it's no good us working on one particular muscle if actually the referred pain is coming from a different one. So that's the first thing, identify the muscle and identify the relevant trigger points even within that muscle. Once we've got that, it will then be a case in terms of releasing those trigger points. It will involve usually deep massage, acupressure style techniques, and trigger point acupuncture is another really useful technique to use with those problems as well. I think you need to try and focus on what's causing perhaps stress and tension in the first place. So postural things such as avoiding what we call forward head posture, having the head too far forward from the shoulders, conscious of what your shoulders themselves are doing. Are you sitting there on the computer, the shoulders hunched up by your ears? That's going to accumulate tension. Keep the shoulders down. Try as best you can to eliminate unnecessary stress in your life. There are some gentle stretches that you can do at home to keep the muscles elastic and keep them stretched out, and even some self-acupressure and self-massage style techniques, which again we can teach you if you come and see us in the clinic.
Thank you for watching this video all the way through. For effective treatment and advice for muscle and joint problems throughout the body at either of our clinics in Chigwell or Woodford, call us at Spineplus to book an appointment on 02 08 501 0937. You may like to know that we've made several other videos with information and self-help tips on specific problems, everything from tension headaches to heel pain. Some of our suggested videos are shown below, or you can search our playlist to discover more. We'd also be really grateful if you could like and share any videos you watch, and please subscribe to our channel by clicking on the subscribe button to be kept informed of our latest information. For more information on our clinics, click Find Out More to be directed to our website.